Okay, I'm mad again today. As many of you know, I am a physical therapist. I've been one for 20 years. I've never seen the healthcare system so broken, and it makes me angry. So instead of being angry, I do these videos on ways that we can try to work around the system. It doesn't always work, but I feel like anything we can do is worth a try until something can change. So in today's video, I'm going to start by talking about one of the reasons that I think healthcare, specifically in hospitals, long-term, short-term care, is so broken. And I'm going to talk about one potential strategy to use as you advocate for your elderly parent who might be in one of these facilities. Before we continue, I just wanted to quickly introduce myself. I'm Tammy. I'm a dementia certified physical therapist and a life coach. And I wanted to emphasize that the videos that I make are separate from my role as a physical therapist working in short-term rehab and long-term care facilities. I've been working with elderly patients and their families for 20 years. I see the struggle, especially in the role of caring for our parents. There's a lot of emotions that are involved in that. So these videos are part of my effort to bring information and strategies to the families that are struggling with how to care for their aging parent. So I'm going to start with talking about insurance just for a minute. Historically, Medicare was the primary insurance, and the way that a facility was paid was based on therapy. And the more therapy someone got, the more money the facility got. In the last couple of years, it's changed. What happens now, just kind of a quick explanation, but what happens now is that when somebody goes to the hospital, they're given a lump sum allocated to their care based on their diagnosis. So they come into the hospital with a heart attack. That has been decided by the insurance company to equate to a certain amount of money. If that person has another diagnosis, diabetes, or they have another issue, they fell and they broke something besides having the heart attack, those things are not considered. They're given this lump sum, and this lump sum amount follows them from the hospital to short-term rehab to home care services, and whatever isn't used gets divvied back to those facilities. So in my perspective, that is a messed up system. What I'm seeing is that care is so much worse. Starting at the hospital level, people are not getting the care they need. They're often treated for one thing, and if they have another thing, it's totally ignored. So then they come to short-term rehab, and trying to get follow-up is so much harder than if they had just done it at the hospital, whatever it was. So for example, I had a patient recently who had avascular necrosis of the hip, which is basically where the bone disintegrates. It doesn't have a good blood flow, so it kind of disintegrates. And the fix for that is a total hip replacement. And she went to the hospital because either her hip broke because of the avascular necrosis, or she fell, and that's when they realized she had the avascular necrosis. But she laid on the floor for 3 days. In that time, there's something that happens where the muscles start to break down and they release chemicals into the system and cause all kinds of havoc. This person went to the hospital. They were dealing with the results of laying on the floor for 3 days. And they very minimally addressed the avascular necrosis of the hip. In this person's case, the hip joint ball broke off the shaft of the femur and was shoved up and back. Think about how awful that is. And the hospital documentation said that the family and the patient herself didn't want any surgical intervention for this. So when I saw this person, I asked her about this. She does have a little bit of a cognitive impairment, so I called her daughter to ask her about this because the patient herself said she didn't know what I was talking about when it came to the hip. So I called the daughter, who told me that she's never heard the words avascular necrosis before in her life. So I can only guess as to the reason why the hospital would be writing that stuff, why they would be documenting in that way. And my feeling is that they didn't want to deal with that second diagnosis because maybe the first diagnosis paid more money. And again, that's totally a guess, just based on what I see. And what I also see since this payment structure change is that people are not hospitalized, rehospitalized like from our facility as quickly as I used to see it happen. And again, I think it's a financial thing, but I don't know that. Recently, I had another patient who felt like she was getting worse, and I was hearing that they were talking about sending her out to the hospital. So I went in to talk to her, and she said something like, I'm afraid the only way I'm going to get out of here is in a body bag. So I asked her, do you want to go to the hospital? And she said yes. So I guided her to advocate for going to the hospital, to just tell them, call the nurse in and tell her, I want to go to the hospital now. And she did, and it happened very quickly. So the moral of the story, moral of today's video is, as your parent's advocate and your parent themselves, if there's evidence that they're sick or they're doing worse or something's wrong, advocate for them to go to the hospital. You have a right to do that as the healthcare proxy, and they have the right also to ask for that, although it's a little more confusing if there's a cognitive issue. And I'm not saying to do this for every little thing that comes up, because there are a lot of things that can be managed at the skilled nursing facility or the rehab facility. But if there's something really going on, please advocate. It seems like things are taking way too long. We need better care for our elderly population. Hopefully today's video was helpful. If it was, please like it and share. Subscribe to my channel and add any comments in the comment section below, including any comments on future videos I might make. Thanks.